Darwin was trying to explain the three funds.
Yes.
But it seems he hasn't understood. He just needs to go back and read the documents for him to know what they are and how they interface. Yes, we will not have managed schemes, and we just want that to be very clear, and that will be in line with answering the question of Amos. Fairness in contribution and fairness in benefits, because previously NHIF had all members were equal, but some were more equal than the others. That is the kind of thing that we don't want to have. What we wanted is to have fairness in contribution, and the reason why we need fairness in contribution is if you earn $1 million and you are paying 1,700. And someone else earns 5,000 and they pay 500. That is 10% vis-a-vis 0.017%. And you know, 1 shilling to a person who earns little is more valuable than the person who earns $1 million. They cannot be related. Fairness in benefits, that is equality. You get all equal benefits, so there is no one who gets extra because they are paying extra, and that is the thing that we need to be aware of. So there were Gregory talked about the issue of marginalized.
Yeah.
Yes. So once you register and you do your means testing, it will identify you as an indigent.
How is this means testing done? Remember, we have a means testing problem at the university funding side.
No, this one is better.
How is this one working?
This one is the one where the education will come to learn from. I assure you, because we have looked at the data, we have piloted, we have tested it in 8 counties. We have gone to the marginalized households at that level. Looked at the model, tested it, and come up with this means testing. So it's not...
so what questions are you asked for it to do that?
Simple questions. What kind of a house do you live? What do you do? Unemployed or self-employed? Where do you stay? Locality? Married? Children? Household, where do you live? Do you own the house? What else do you own in terms of, is it 10 acres? Is it, do you have livestock? Do you have electronics? Do you have cars? So you answer all those questions, and then finally it will give you a premium that you need to pay. So it also identifies you as an indigent. So it says Abdi is poor and the amount is 50 shilling. So that's someone who can't afford the minimum premium of 300. So this one is the person now who is identified as indigent, and they're the ones who are supposed to be paid for by the national government. But there are others who have been identified by the Ministry of Social Protection. The one for Waze, yes.
It's called the Inua Jamii.
Inua Jamii.
So the people in Inua Jamii
automatically will be moved to SHA and will be given the beneficiary, paid for by the Ministry of Social Protection. So those ones, they don't have an issue. So it's these other ones who are unemployed, never identified as indigents by anyone. Those are now the ones who will be identified through the proxy means testing.
How are you getting the information from the State Department for Social Protection into this one?
No, they are giving us the list. So they will say these are the people and these are the people we are paying for. Yes. Actually, and it's not supposed to be physical receive. It's API. We connect into their system, and the data is migrated automatically to the database of SHA that says these are the people we are paying for, and this is the process. Similar to the people who are paid for by governors or MPs. So they will list and say, these are the people. But you know those ones now, because they are not indigents as such, it's people now who are under social protection from the governor. Then they will register, similar process, calculate their premium, then the governor or whoever is paying will pay. So the issue of insurance is, he said, pay less and pay more benefits. It's not. The way this social health insurance works is everyone pays to their ability. There's no round figure to say this is the universal figure that we are paying for. You are paying according to your ability. And then we put that together, and then we give you benefits based on availability of resources. So it's not a matter of demanding, because I have paid more, I need more. Or I have paid less, because what will happen is the person who pays 3,600, if you go to the private market and you say private insurance, they say that they can do last expense only for this one, no medical. So you can imagine if that was the route that we had taken. So it is for that reason that we are saying people need to pay according to their ability and get equality in terms of benefit. Sustainability depends on, and this is the reason why our benefits are not superfluous, like humongous to say we can do this, we will give you this. No. We are able to rationalize and say, this is what we have in terms of resources, and this is what we can offer. If we need to offer more, we need more money. And that's how we have justified. And that's why we have also removed the issue of managed schemes, because they were draining the basket. They contribute 1 shilling, they consume 3.
And the other 2 are contributed by others?
By others.
Okay.
And the sustainability becomes a big challenge.
Let's take 2 more calls before we conclude. The first one is Moha in Nairobi. Moha, good morning.
Good morning.
How are you?
I'm good.
Please ask your question.
One thing that is very surprising to me is that we are discussing SHA as if it's a noble social program. Let me just help those who are listening here to zoom out for a bit and look at this thing critically. We are discussing a scam. I'm going to repeat that again. We are discussing a scam.
Okay, elaborate your point. You've got a minute, Moha.
How? I don't even know where to begin. I don't know where to begin, honestly.
A question?
No, it's not a question. I'm just putting it out there so that people get a clear picture of what is happening.
What makes it a scam?
The whole thing. There's no part of it that is here to benefit anybody. Maybe those who cooked it up. As in, for me, it's preposterous. I don't believe what I'm listening or hearing.
Okay, Moha. Let's hear from Samuel Mwariri. Samuel Mwariri, good morning.
Good morning, Eric, Viti, and Daktari.
Good morning. Should you ask the question, please?
Okay, mine is for that, the means test. They have said they have piloted and does what and whatever, but why do they not use the KNBS report? You were just from census like 2-3 years ago. Why do they not use that? Because it was a real deal. We were told to go home, so you are counted and they saw whatever is in our homes. Then if they say, for example, they ask questions. I've tried registering to that SHA. They ask the question of, do you live in a stone-walled house or something of so? What if that person is hosted? That's not his home. There are many people who are hosted here outside. Then you are 18 and above and maybe you have no work. And they give you a quotation of maybe 1,800. Where do they expect you to come with that kind of amount? Then the other thing, to the to some other civil servants and companies, they use the private insurance. What about them? Are they still linked to NHIF? Is it a compulsory? Why should it be then a compulsory? And if it's not compulsory, then how? What about the private insurance? Right. And to the and now to the last one.
That so he can respond to that because we're running out of time.
Okay.
So respond to that one by Samuel.
Thank you. We have used the data for KNBS. And this is the other thing that people need to realize. What we have done is that database is our baseline. So the reason why we have gone back to 18 counties is to test it, and more so the lower socioeconomic status, and see, does it really reflect on the reality? Because you see, you can have a national survey, but you also need to go and try and see, does it really work at that level, so that you validate and say yes, or you need to tweak a little bit more and make it better than what is available. So for me, I would say that's the reason why, and that's why I was telling you, the education will come and learn from us because just taking global data alone will not be helpful, but you need to go back and see and test it, pilot, as CT says, to the ground, to individual households, and find out what you get on this other end. Is it the reality as you are seeing it?
Final thing, Daktari, as we close the show, in about 30 seconds.
Yes.
Many of the people who are commenting, even on our live stream, as you can see it on social media, many of them are saying, there are so many people who just don't believe this thing. They don't understand it, they just don't believe it, they're just seeing red flags everywhere. What do you say to them as the chairman of SHA?
I think what we need to do is do a lot of more communication and education, actually, not even communication, because people need to understand and they need to realize that for the first time, there are benefits that you get without even paying a premium in this. So you are moving away from a space where you had to be a member, paid up for you to benefit. And even previously, you had to have paid for 2 months waiting period for you to get a benefit. But for SHA, we are saying you pay today, you access benefits today, immediately. So you see, those are the things that people are not yet understood.
So it will take time to
it will take time
create this
for
awareness.
Sure.
Please do. It's important. Thank you for joining us today. Dr. Mohammed Abdi is the chairman of the Social Health Authority. He's been our guest for the last 2 hours. We'll have him again with more questions from you. 10 a.m. Have a lovely day. See you tomorrow.
It's now 10 o'clock with Safaricom. Go monthly.